Hi, my name is Eric Schwartz, and I have researched chronic heart failure. I will be doing a presentation for you today regarding this health disorder. So, what is chronic heart failure? Well, chronic heart failure, also known as congestive heart failure or CHF, occurs when the heart is unable to properly pump blood. This leads to blood pooling in the lungs, and if left untreated, can cause a wide range of symptoms, including death. Now, this is caused by a multitude of factors, including things such as high blood pressure, coronary artery disease, and other things such as stroke, etc. Now, chronic heart failure can be either diastolic or systolic, or left or right heart, or total chronic heart failure. Now, as we see in the diagram down at the bottom right here, the stiffening of the walls of the heart leads to a weakening of the heart, and this in turn causes a lower quantity of blood to be able to pump out of the ventricles, leading to blood pooling. Now, I have a brief video to show you regarding an overview of chronic heart failure.
Hey, you know what's better than a $5,000 PC? A $5,000 PC that costs $0. It's time!
CHF stands for congestive heart failure. It's a chronic condition that affects the ability of the heart muscle to pump blood adequately throughout the body. We created this video to cover the medical definition and provide a quick overview of this topic. So if you're ready, let's get into it. What is congestive heart failure? As we mentioned, CHF is a progressive chronic condition that impacts the ability of the heart muscle to pump blood throughout the body. It's often caused by hypertension, coronary artery disease, or other valve conditions of the heart. When the ventricles are unable to pump effectively, blood and other fluids begin to accumulate in the heart, which then leaks into the lungs, abdomen, and other parts of the body. This explains why fluid overload is one of the primary signs of CHF. When fluid begins to accumulate in the lungs, this is known as pulmonary edema, and it leads to several different breathing and respiratory issues. Other than excessive fluid buildup, some other signs and symptoms of CHF include hypoxemia, dyspnea, tachypnea, orthopnea, diaphoresis, cyanosis, peripheral edema, and jugular venous distension. Each of these signs and symptoms plays a role in the diagnosis of CHF. However, the following diagnostic tests would also be helpful: chest x-ray, electrocardiogram, echocardiogram, arterial blood gas, complete blood count, hemodynamic monitoring, and cardiac enzyme analysis.
So, in the development of chronic heart failure, it consists primarily of 4 stages, each developing more severe symptoms. In stage A, congestive heart failure, that is patients who have a high risk of developing heart failure, but there is currently no pumping dysfunction, and that is, of course, the stiffening of the heart is not fully developed in terms of pooling the blood. Stage B of CHF is where the structural problems of the heart do begin, yet there is no symptom onset at this point. So this is where the heart becomes weaker. Something such as high blood pressure has caused the heart to weaken, yet there is no symptoms at the moment. Stage C is where some symptoms begin to arise, such as shortness of breath and fatigue. Also things such as loss of appetite or general edema of the lower body, etc. There is now an interference in the healthy blood flow, and there will begin to be fluid buildup in the lungs. And the final stage, which is stage 4, significant symptoms, even at rest, begin to show, such as constant fatigue and shortness of breath, as well as things such as chest pain, etc. And at this point, advanced care is often required. Now, in terms of symptoms of CHF, the symptoms may vary depending on the severity. Now, this can include a variety of symptoms alone or combined, including shortness of breath, like I said earlier, weakness, fatigue, as well as rapid or irregular heartbeat, persistently coughing and wheezing, chest pain, decreased alertness, nausea, swelling of the abdomen due to excessive fluid buildup, as well as the reduced ability to exercise due to any of the following above symptoms. Now, one thing about CHF is that according to whether or not it is left or right heart failure, you can have some differing symptoms. As we can see on the bottom diagram here, some symptoms associated with left heart failure include the shortness of breath, as well as palpitations and fatigue, whereas right heart failure includes the loss of appetite and the lower extremity edema. Now, living with CHF can be a struggle, and here we have a diagram of some ways to cope with heart failure, including engaging in regular exercise, wearing a fitness tracker, reducing stress, and lowering alcohol intake. And I'm going to show you a brief video now about a woman and just some commentary about people living with heart failure.
Perseverance. I just power through. It was definitely harder in the beginning because you're just adjusting to having children. And then there was a lot of fatigue, a lot of, I can't do this, I'm not going to make it. We live in a 2-story home, so stairs are still can be a challenge. I'm not supposed to carry the girls, much less upstairs, but don't tell Dr. Park that I do. But I would do anything for my girls. So I do it with heart failure.
I think the biggest challenge that I have, well, there are a couple of challenges, but I think the biggest one is really getting individuals around me who don't know about my diagnosis to understand what heart failure is. And for them to be able to understand that not all heart disease is necessarily due to lifestyle factors. I think a lot of people assign a certain degree of responsibility to individuals, assuming that they do certain things and you have this certain outcome. And in many cases, that's true. But for me, I didn't have the traditional risk factors like diabetes, high blood pressure, etc. that would have led to that. So basically, it became the story that I had to tell of this disease that just sort of appeared, and being able to get people to understand that the need to still get themselves checked and be able to have important follow-ups at certain points, because it can pretty much happen to anyone. And so I think that was a big challenge. But then also from a more personal standpoint, I think just recognizing the fact that I have to sort of temper some of my goals a little bit from a physical fitness or athletic standpoint, to realize that now the training now is more about health and not training to compete anymore.
I don't live to the disease. I really don't.
Now, those were just a few testimonies of some individuals living with CHF. And CHF can affect exercise. It hinders the ability to efficiently exercise, where CHF individuals may only reach about 50% or less of their maximal cardiac output compared to some healthier individuals. Now, here on the right, we have a bit of information regarding reduced exercise functions, such as reduced pulmonary reserve, reduced cardiac reserve, and there's also skeletal muscle dysfunction, as well as other contributing factors towards CHF, such as obesity and nutritional factors. Now, blood may accumulate in the lower extremities, causing difficulty with movement and range of motion in exercise with those with CHF, aside from the cardiovascular side effects. And shortness of breath is also a major concern when exercising, and precautions need to be set, like persistent RPE during a program. Now, on the other hand, exercise can also affect CHF, whereas exercise promotes many health benefits in general, but in terms of specific heart function, Physical activity strengthens the weakened heart muscles, improving output and stroke volume, allowing the blood to pump more efficiently, leading to less pooling of the blood. Exercise also dramatically reduces the risk of developing CHF in individuals without CHF. Now, in terms of diagnosis and treatment, there are many methods of diagnosing CHF. Some examples include a chest x-ray, an ECG, echocardiogram, as well as a stress test, or a coronary angiogram. Some medications for treatment include things like beta blockers, diuretics, Vercuvo, and treatments that do not involve consumption include coronary bypass surgery, ICDs, and ventricular assist devices. Now we're going to be looking at my case study here, and we have John Doe is a 56-year-old man who suffers from congestive heart failure. He has a blood pressure of 145/96 and is currently taking bisoprolol beta blockers. He has a family history of high blood pressure as well as heart attack. He currently weighs 364 pounds and has been in the process of trying to lose weight. He lost hope after losing 20 pounds and gaining it back. That's when he came to me. He wants to be as active as he can to prevent a heart attack and better his health. He does have minor shortness of breath as well as weight-derived mobility limitations. Now, due to his weight, as well as his high blood pressure, we're going to be performing some basic exercise tests, such as the 1-mile Rockport walk test, as well as a leaning wall push-up test for endurance and a 1-rep max leg press. Now, for the exercise program specifically, this patient will be required to acquire a medical clearance to begin the program, and it will be a very basic program due to his lack of mobility, congestive heart failure, and his high blood pressure and risk of heart attack. We will be doing a 20-minute walk 5 days a week with minimal exertion by using a talk test. If that talk test fails, we will have a 2-minute break and begin again from there, accumulating 20 total minutes. Followed by a bench press of 3 sets of 8 for 30% intensity with a 1.5-minute rest on Mondays and Wednesdays, and a stand-up sit-downs, 3 sets of 8 with a 1.5-minute rest on Tuesdays and Thursdays. So we're going to need some necessary modifications for John Doe here because he may develop symptoms during the workout, so rest sessions need to be added throughout if necessary. And RPE will be tested throughout the program between each set and every 3 minutes of that cardiovascular activity each day. The program will be altered as he loses more weight and gains more mobility, but we will have to continuously make sure that his rate of perceived exertion is not too high due to his chronic heart failure. Now, in conclusion, heart failure is the leading cause of death among Americans annually, aside from general accidents, killing over 2,000 a day. It is a severe health risk that needs to be at the forefront of prevention among the younger generation to reduce cases and promote healthy lifestyles. Now, I hope you were able to gain some more knowledge regarding CHF through my presentation. Here are the references provided.